to explain the trick.
This may look like ordinary playtime, but it's much more than that. This is play therapy, because working through complex emotions lying on a couch isn't exactly kid-friendly.
Using play allows for us to speak the language of kids and help them in a non-threatening way work through issues that they have. Sometimes they don't even know that they're struggling, but allowing them to play things out allows them to heal.
While it sounds easy to incorporate these practices, the process of teaching kids how to work through a traumatic incident and emotional well-being can be complex. The current mental health crisis that kids in our community are facing has created many obstacles in accessing care. Luckily, there are people in St. Louis that are providing solutions to our most vulnerable members of society.
Good job.
The community reach is really about improving outcomes for underrepresented communities, focusing primarily on mental and emotional wellness.
A child who may be acting out in school or home can utilize a play therapy session to freely express those emotions. Drawing a picture or playing with toys can help uncover to the trained therapist what underlying issues may be causing the child's behavior. The therapist will then discuss their observations with the family to develop a specific plan of care to support the child.
What we try to prioritize is not just providing holistic services to the community, but also investing in our service providers as well.
One of the major obstacles for families seeking play therapy services is the national shortage of mental health providers.
What I learned was that it wasn't that they didn't want therapy. They didn't want it from who they had the option of getting it from.
According to the American Psychological Association, only 4,000 out of more than 100,000 U.S. clinical psychologists are child and adolescent clinicians. Even if you do find a provider that is accepting new patients, the wait list can be months. Not to mention, if you're looking for a provider with a more specific background or cultural understanding, resources are even more scarce. Data from the American Academy of Pediatrics shows that only 2% of the estimated 41,000 psychiatrists in the U.S. are Black, and just 4% of psychologists are Black.
When you look at trauma, when you look at depression, when you look at anxiety, you cannot look at those diagnoses without also looking at the person and their environment. You can't treat those symptoms without also recognizing that they're exacerbated by the lived experience that being a marginalized person in this country and even this world.
These challenges that most of Ebony's patients face is what connected April Duncan with the community reach.
Influences, emotional experience, all those things greatly influence a child's development. I had the honor of being connected with Ebony. She's gone through play therapy training and she reached out and she's like, I have this grant. I'm trying to get more clinicians of color into the field and especially with play therapy. Play therapy certification is not cheap, and so oftentimes people are priced out from getting this certification. And so I've connected with Ebony and the community reach to provide play therapy certification for her therapists in order to serve foster youth who oftentimes are also left out because of Medicaid and things like that.
There have been proposals in the field to help meet the increasing demand for child mental health professionals, such as federal initiatives that would repay the student loans. But if the price is an obstacle for providers, it's of course an issue for families, as some insurance plans cover these services, but a lot of times the care is out of pocket. However, with the increase in need for child mental health services, there are also more resources available for families to implement at home.
What we're doing is holistic. It's, it has to be the family, it has to be the communities, because this is hard. It's hard when, you feel like sometimes maybe the biggest blessing that you have is also a huge burden, because we navigate this experience as Black and brown parents extremely different.
Wait a minute, what?
There are many benefits to play therapy for children from all walks of life, even if they aren't dealing with serious issues that need immediate attention.
Play is what kids do to just communicate, to deal, to figure things out. naturally. What I want to do is just to be able to create a safe space, for holistically for our community.
You don't see a police car.
You don't see the police car?
I think when we add in COVID on top of everything, and just everything that, our level of violence and all the things that kids are dealing with here in the city, it's imperative. I think that anyone that is a mental health professional that's working with a kid needs to do some type of training in play therapy.